Amy?
Hello, everybody.
Wait till we see the recording.
Okay.
Oh, there it goes.
There we go. Hi, my name is Amy Remke, and I'm the Vice President of Marketing with Greencroft Communities. Welcome today. Thank you for joining us. We have in the Greencroft campuses, we have what's called Croft Values, which most of us here are well aware of, but that stands for creativity, respect, openness, fairness, and teamwork. And particularly in this last year, we've seen or had to use the framework for our Croft values and helping us to make decisions every day on how we're going to treat each other, our residents, and make decisions for how we go about handling this COVID pandemic. Part of that is to maintain transparency with how we work together, and also making sure that everybody knows what we know. So there's nothing out there that we're not going to share. So we've put a lot of information on our website around COVID, and also we've wanted to provide all of our team members with information and resources on the COVID vaccine so that everybody can make that decision for themselves if they wanted to participate in that vaccine. So as part of that, we wanted to put together this video, which is a town hall format and a conversation around the vaccine to provide information to all of our team members. I want to introduce a couple of people here that I have on the call with me. Jenny Longbreak is our VP of Human Resources. She helped me put together this call. Cherry Smith is our Director of Clinical Services. She's also with us. And we also have several of our campuses. We have Southfield Village, which is on the south side of South Bend, Hamilton Grove, it's in beautiful New Carlisle, and Greencroft Goshen. And our campus in Fort Wayne is Golden Years Homestead is also with us. And we have a campus in Ohio, Walnut Hills, which is in Holmes County, Ohio, which is another beautiful area that we have. And then also I want to introduce to you Dr. Nafziger, who has joined us. He is the Chief Medical Officer at Goshen Health, and he's a board certified infectious disease physician, and he's been working in the area since 2002. He's the health officer for Elkhart County Health Department. He was the medical director at Everence, and he was the medical director of hospital epidemiology at Henry Ford Health System, which is in Detroit, which is a pretty big health system in Detroit. So when we're thinking about COVID, having somebody who has those kind of credentials is certainly somebody that we wanted to be able to talk to. So he's here to give us a presentation on the COVID vaccine, and he's going to share his screen, and then we'll also take some questions from each of our campuses. Dr. Nafziger?
All right. Thank you very much. Let me see if I can find the right screen to share. Can you see the title slide with orange?
Yes.
Okay, well, we'll go ahead and get started. First of all, I would like to express my thanks to the Greencroft communities. I actually have some history going back quite a ways. My grandmother would have been cared for at Walnut Hill in Ohio, Walnut Hills, many years ago. And more recently, my father and mother, Merle and Twyla Nafziger, were cared for at Greencroft here in Goshen, as well as my in-laws, Wilmer and Lois Hartman. And some of you may have helped provide care for them, and I will be forever grateful for that care. Anyway, I am a local Goshen person, and I have a strong sense of affiliation with Greencroft communities, and I'm glad to have this opportunity to talk to you today about the COVID-19 vaccines. I think these are going to really be important in terms of trying to get our society back to normal, as well as protect those of us who have to provide healthcare to our community. And so I'm going to try to answer some of the common questions that I'm hearing, and then leave time for your questions and answers that are on in addition to that. So why should you get vaccinated? I think there are a number of reasons. First and foremost, to protect yourself and your family. I think secondarily, to protect others in the community and the patients or clients that you're serving. And I think as healthcare workers, we can also set an example for our community in terms of what's the right thing to do in order to cause this pandemic to go away. And I hope I'll be able to convince you that vaccination is a common sense measure at this point to try to protect yourself as well as to protect our community. These are some of the most common questions I get, and we'll run through them one at a time. So the most important thing I think everybody's concerned about is whether the vaccine is safe or not. And clearly safety is the top priority whenever vaccines are developed, because as opposed to a drug that people get when they're sick and in the hospital or sicker and in the intensive care unit, these are pharmaceuticals that are given to healthy people. And so you really need them to be safe, or people aren't going to accept them and they're not going to be used. And if they're not used, they're obviously not going to work, even if in a clinical trial they can be demonstrated to work. Another thing that's known from other vaccines that have been used is that most of the side effects of vaccines really do occur in the first few weeks after vaccination. And certainly by the time you get to 6 weeks or 8 weeks, essentially the side effects that you're likely to see are going to be found during that time period. Most of the time when the Food and Drug Administration does a vaccine trial, they will look at 3, 4, 5,000 people in the trial. These are much larger trials because they really wanted to make sure that the vaccines were safe, because it was recognized that we are going to have to use these in large numbers of people. I put this slide together over the weekend, and at that point, the most recent number I saw was 43 million doses administered. I think it's actually now 50 million doses administered. Now, not everybody has gotten 2 doses. It's probably more on the order of 40 million different people that have been getting the 50 million doses that have been given. But even though I'll talk about clinical trials that we're talking about 30 or 50,000 people, and those are big trials, we really are in the tens of millions of doses administered at this point. And so we have a pretty good basis to think about the safety of these vaccines. In addition to safety, people obviously want to know, are they effective? Do they work at preventing disease? And these are the numbers from the 2 products that have gotten emergency use authorization. If you follow the news at all, you've probably heard about Pfizer and Moderna, and both of these have very close to a 95% protection against getting symptomatic COVID-19. So much better numbers than anybody anticipated a year ago when these vaccines were just being thought about and at the very earliest stages of being developed. The 2 trials are highlighted on this page. Pfizer had over 40,000 people enroll, and Moderna had ended up over 30,000. And they were reasonably diverse trials. The Pfizer one had 10% Black folks that were in it and 13% Hispanic, and the Moderna was 10% Black and 20% Hispanic. So maybe not a perfect reflection of the American population, but not a bad diversity in the people they were able to recruit to the trial. In addition, there were a significant number of folks that were older, and they used kind of different cutoffs for analyzing some of their data between the 2 trials. But it wasn't like they went out and just got young, healthy people for these clinical trials. They were reasonably representative of what the American population looks like. One of the other things that people are really concerned about is whether the vaccine was rushed. And that's because it often takes 10 or 20 years to develop a vaccine. These are not things that historically have happened in a year's time. And in addition, just the whole name of Operation Warp Speed that the government gave to helping these vaccines along sounds kind of ominous from a safety standpoint. But in fact, none of the safety steps that are used to develop vaccines were skipped at all. And really, the primary risk of these vaccines in terms of developing them fast was starting to manufacture them before we knew they were safe. And there was a chance that the vaccine wasn't going to work, and that those vaccine doses would have to be discarded. But fortunately, we had a very good result from the clinical trial. The other thing is, a lot of the conspiracy theories are kind of focused on big pharma, these big drug companies and whether they have some kind of sinister intent. But the fact is that the process doesn't go forward without two independent advisory committees reviewing all the results of the clinical trials in detail. And those are basically the Vaccine and Related Biologic Products Advisory Committee at the FDA, and then a separate group that advises the CDC that is not, they aren't CDC employees, they're not employed by the government, they're an independent group that looks at the safety and effectiveness of the vaccines and makes recommendations about how they should be used. Now, one of the other labels with the vaccines that bothers some people is this label of emergency use authorization. And basically, this is a mechanism or a process that the FDA uses to get a vaccine available to people quickly. But again, no safety steps are skipped in this process. The primary thing that's different about this compared to the more traditional route is that we don't have as long a term follow-up in terms of knowing how long the vaccine is going to work. So I feel very comfortable from a safety standpoint that we know about these vaccines. What is difficult at this point is to say, is this protection that's going to work for a year, 2 years, longer? The vaccines are new, the disease is new, and we just don't know how long that protection is going to last at this point. So I've kind of touched on how the vaccine was developed so quickly. One thing was there are just a whole lot of people that were interested in making this vaccine and making it very quickly. It was obvious to scientists and to physicians way back in February of last year that we were in trouble with this virus, and an enormous amount of scientific effort and government support has been put into making this vaccine or these vaccines. I suspect that we would have had vaccines develop more quickly in the past if we'd had these kind of unlimited resources applied to developing the vaccines. Both of the first two available vaccines are mRNA, that's messenger RNA vaccines, one from Pfizer, one from Moderna. One of the things people ask about is whether they contain the virus or whether you can get COVID from the vaccine. They don't have the virus in the vaccine. You can't get COVID from the vaccine. This is not a live virus vaccine or something where you can catch COVID from the vaccine. Basically, over the last decade or so, people have been working on this kind of technology to develop new vaccines. So it's not like the whole process was ready to go a year ago. It's really like we had a system built up or the capabilities to make these vaccines a year ago. And this is the ideal opportunity to translate all of that knowledge into an actual product. And what happens is the vaccines basically give the cell or our cells a harmless piece of RNA that makes something that looks like the spike protein. This little part on all these coronaviruses that you see in the pictures, that little red knob on the surface of the virus is the spike protein. And basically, this signals our cells to make this protein, but not make the whole virus. And then our bodies, our own immune system, recognizes that that spike protein shouldn't be there. It's not natural. It's not part of us. And so your own immune system responds to that spike protein. The RNA never gets into your nucleus. It's not DNA. It doesn't alter your DNA. It can't do that. And So it's not something that we have reason to believe should be in any way worrisome about kind of ongoing effects from the vaccine. The two vaccines are two-dose vaccines, either at 3 weeks or at 4 weeks apart. And generally, we would say after 2 weeks after your second dose, you should be protected from getting COVID-19. Now, that's true. It's 95% of people. It's not 100% of people, but it's a really high number of people will be protected after that second dose. And as I've said, the primary thing we don't know about this vaccine is just how long protection is going to last. And so it is theoretically possible we may have to get booster shots for COVID in the future. Part of this probably depends on how much virus circulates on an ongoing basis and whether we get boosts from being exposed to the virus out in the world, quite apart from getting vaccine doses. And part of it will probably depend on these variants or how much the virus changes over time as to how often we may need to get a booster dose. As I've said, you can't get COVID-19 from this vaccine, but because the spike protein is there and produced by your body's cell from the vaccine, and your immune system is responding to that, you can get short-term discomfort that may not be terribly unlike some of the symptoms people get from COVID, including fatigue, headache, muscle pain, chills, fever, pain at the injection site after vaccination, like all other vaccines. Typically, this lasts for 24 to 48 hours, and it may be more pronounced after the second dose, but it goes away very quickly. When I got my first dose, I would have said that I thought I had gotten placebo. I had no symptoms whatsoever. Even my arm wasn't as sore as it typically is after a flu shot. With my second dose, I got it on a Friday. On Saturday in the afternoon, I thought, I could be starting to get a headache. And my muscles feel just a little bit achy. And I don't know. I'm tired a lot these days, but maybe I'm a little more tired than I should be on a Saturday afternoon. And because I thought I was getting a headache, I went ahead and took a couple of Tylenol. And within an hour or two, I felt perfectly fine. Now, there are people, particularly younger people who get this vaccine, who will say, I really didn't feel good. I felt like I got run over by a truck. But feeling like you got run over by a truck for 24 hours is much better than ending up in the ICU related to COVID. And really, those symptoms really do signify that your body is developing an immune response. You don't have to feel bad to get a good immune response, but it is a sign that your body's doing what it should be doing. These are the kind of numbers that have been reported with these vaccines. But interesting thing is, like, if you look at things like fatigue, about a third of the people that got placebo had fatigue. I mean, it's not unusual given the stress and the work that we're all doing that we get tired at times. Fever, it's not even a quarter of people get fever, but it's not like I can tell you there's no chance that you're going to get fever after you get the vaccine. You do need a second dose to get the same level of protection that we expect to offer that 95% effectiveness. Obviously, there's been a lot of stuff in the news about delaying second doses so everybody can get their first dose. But at this point, the recommendation is that everybody gets the 2 doses. It is safe to get the vaccine even if you've had COVID. In fact, there's some suggestion that you'll get better immunity and longer protection from the vaccine than even if you had natural immunity. And in fact, the people who are the least symptomatic or asymptomatic seem to lose their antibodies faster to COVID and are probably even more in need of vaccine than an average person that's had COVID. If you want to get additional information beyond what I've talked about here, I would recommend sending you to the CDC website. You can also, look at the University of Pennsylvania's Vaccine Education Center. But these are good resources for getting more information. And basically, I would just emphasize that we're all going to need to get vaccinated and develop immunity as a community if we're going to get this pandemic under control. And I think I'll stop there for questions.
Great. Thank you.
Probably I should stop sharing my screen if I'm clever enough to do that.
Okay, great.
Can you see everybody again?
Yes, yes. we
Okay,
can.
great.
All right. Thank you so much, Dr. Nafziger. That was great information. We do have questions, and so you answered the first question for our facility at Golden Years, but they have come up with another question, so I will let them ask you their question.
Hello. Can you offer any suggestions to counter a person's denial to obtain the vaccination if the recipients must wear a face mask, still must follow the protocol, and are uncertain of the vaccine's effectiveness against the variants of the virus?
Well, at this point, we have a fair amount of information that's being developed that does look like the common variant that is starting to spread in the United States, the B.1.1.7 from the United Kingdom, will be, you will get protection from the vaccine against that variant. So I can't offer a guarantee that, now and forever, this particular vaccine will protect you against COVID-19. But the reality is that it will protect you against the viruses that are circulating in the United States now, and why you would want to wait and get COVID and potentially be disabled or die in order to hold off for a vaccine that hasn't been developed yet against a variant that might never arise doesn't make logical sense.
Thank you. So our next question is for Southfield Village. However, you answered their question in your presentation also. So Delynn, Heidi, Lisa, do you have any questions that you'd like to ask that's not on the list?
I'll go. I'm just wondering, is there a particular time period which you're supposed to wait to get the vaccine after you've been COVID positive? We've had people saying, doctor said nothing for 30 days, nothing for 90 days.
Well, this has been a point of some confusion because, the vaccine has been in short supply, and particularly during that first month when the vaccine was being rolled out, the CDC did give guidance that it was fine to delay vaccination for 90 days after you've had COVID. And basically that was a vaccine sparing approach so that people who had no immunity could get vaccinated while people who already had immunity, could wait a few months. So it is fine to wait a few months after you've had COVID. Primarily, we want you to wait long enough that you're not infectious and you're not coming into a vaccine clinic while you're shedding virus. But the reality is that you can get vaccinated as soon as you're no longer infectious, and that's just fine. We have not seen particularly severe reactions or anything like that in folks that have already had COVID. I would have to say that, anecdotally, the arms may be a little sore and people may feel a little rougher. There is some data to suggest that, even the one vaccine dose probably goes much further in protecting people that have already had COVID, but there really isn't a cutoff when, aside from being infectious, that people can't or shouldn't get vaccinated after they've had COVID.
And does that go to if they've had the infusion, like the antibody infusion? Because the pharmacist thought that might be the only reason they would have to wait.
Yeah, so that is a different circumstance there. If they've gotten the monoclonal antibodies, what some people call BAM or BAM or the Regeneron product that that President Trump received, then the recommendation is to wait 90 days. And that's based on how long that antibody is in your system. So you're still going to have protection from getting COVID again during that 90-day time period, but that allows your antibody levels to fall enough that you get a good immune response when you do get your vaccine. Because it could be that, if you went out and you're loaded up with those antibodies, that they would just bind all the spike protein that your body creates from the vaccine, and your body might not make its own immune response well in that situation. So that is a circumstance where you would want to delay.
Thank you.
Great question, Dylan. Okay, so next we're going to go to Goshen Health, or Trinity, I believe you are asking the questions.
Hello, Dr. Nafziger.
Hello.
Can you hear me?
Yes.
Okay, so this question, nationally, the percentage of healthcare workers not taking the vaccine is high. Why do you think that is? And has it been the case at Goshen Health as well?
Well, so we initially surveyed our colleagues before the vaccine was available and asked them if they were willing to get vaccinated or not. And honestly, I was pretty disappointed because it was only about 63% or so of our colleagues that said, right up front, I'm willing to get vaccinated. Now, we have checked with our physicians and nurse practitioners at Goshen Health, and it's over 95% of our physicians and nurse practitioners are either getting vaccinated or planning to get vaccinated. We have a small percentage of folks who are pregnant, for example, and are, waiting until they're not pregnant before they get vaccinated. But 95% tells me that the folks that know the most about the vaccine and have the most experience with patients having received the vaccine, it's a pretty ringing endorsement. We are not that high yet for all our colleagues getting vaccinated. We're seeing steady upward trends, but we're not really where we want to be yet. And I would have to say that it probably reflects the fact that our colleagues are Hoosiers, they're Americans, they're like everybody else, and they have some distrust of big pharmaceutical companies. They have Facebook where they can get lots of misinformation. They have a general sense of, I just assume a few other people get the vaccine before I get the vaccine. I remember when my kids were small and the chickenpox vaccine was introduced, I was thinking, I don't need to be the first person to be at the doctor's office to get this vaccine. But the fact is, we have good data about chickenpox vaccine, and we're going to continue to get good data about these vaccines, that they are safe and effective. And particularly for this vaccine, you look at the chickenpox vaccine, maybe 80, 100 kids a year died of chickenpox in the pre-vaccine era. We're looking at nearly 500,000 Americans that have died of COVID-19. And, if you look at something like, a 1 in 100,000 chance of an allergic reaction that is treatable versus 1 in 200 chance of death, depending on your age group, it's going to be significantly lower, significantly higher than that. But this is a very easy call from a risk-benefit ratio, assuming you want to live and don't want to be disabled. These vaccines are really the way to go to keep yourself healthy.
Okay, thank you. Walnut Hills, Teresa.
Yeah. Are there risks in taking the vaccine for women or men who may want to have children soon?
I would say no. The vaccines were not specifically tested in pregnant women. So for pregnant women, I think the risk calculation is a little bit different. I think you kind of have to weigh your risk of getting COVID, where we know pregnant women have worse outcomes, versus your ability to stay at home, not leave the house, not have your significant other bring COVID home to you. Have to weigh all those things. I would feel pretty comfortable, from what I know about the vaccine, getting vaccinated if I was pregnant. If I was in a higher risk group, as in I was working in a long-term care facility, I would probably get that vaccine as soon as I could. If I was in a low risk group that could stay home and not socialize with other people, I might wait till I was 24, 28 weeks pregnant and, all the organ systems had developed. I don't think there's significant risk there, but it really hasn't been studied. So I can't be too dogmatic about that. But in terms of you're planning someday or in the near future to get pregnant or to father a child, I would say get vaccinated right away so you don't have that pregnancy concern down the road.
Thank you. Okay, we're going to go back to Southfield Village now. Who's going to ask the question?
If nothing changes for me with masks, social distance, and avoiding gatherings, why bother with the vaccine?
Well, I would say it really is a matter of patience, because I do think the day will come, if we can get this pandemic under control, that we will see all of these control measures walked back and eventually, hopefully, eliminated. Now, I don't know what's going to happen with masks. This may not make everybody happy. I'm not here to win a popularity contest, but I don't know what's going to happen with masks long term. Because like this year, we've had almost no flu. We've had very little RSV. I'm aware, for all of Goshen Health, I'm aware of one case of flu. RSV admissions way down. Almost all these respiratory viruses are way down. And I think we'll have to ask ourselves as a society, in the wintertime, is it worth masking to keep everybody else healthier when we're not with the people that we normally spend time with? So I don't know how all of that is going to play out. But in point of fact, I think there is a level of reassurance for people who've been vaccinated and are 2 weeks out after their last dose of vaccination, that they can start socializing in ways that they haven't. Now, I didn't really go into transmission a lot. Part of the reason people have been hesitant to start unwinding all of these rules is we don't have a precise number for how much this is going to interrupt transmission as opposed to interrupting disease. But from what we know about all other viruses and other vaccines, everybody is fully anticipating that this is going to make a significant dent in transmission as well. And I think once transmission is down and our hospitals are not being overwhelmed and the entire state of the country has improved significantly, I think you'll see a lot more of a return to normal, where people are willing to go out to eat in a restaurant, or willing to go to concerts, or willing to do the kinds of things that most of us like doing. But I think it's kind of it's setting an unrealistic expectation to say that I'm not going to get a vaccine unless I'm promised that the whole world is going to be back to normal tomorrow. You can set unrealistic expectations so that no matter how good the vaccine, how fast it works, how cheap it is, how safe it is, that you'll never meet those expectations. Because, even in your or my perfect world, there are going to be people who are going to be refusing the vaccine, and then, we may see ongoing transmission because of them. So the very argument to not get the vaccine is what's keeping us all in masks. It's, you can just make it impossible for any vaccine to meet that kind of a standard.
Okay, thank you. So we're going to go back to Fort Wayne. Fort Wayne, Golden Years, you have a question?
The younger population most likely to be asymptomatic to a COVID infection. With the odds in their favor and knowing the side effects of the vaccine can be unpredictable and potentially damaging long term, it can be argued that developing immunity naturally versus getting the vaccine is not a bad decision. How do we dispute this?
Well, I've summarized what we know so far in terms of long-term side effects, which are none. So when somebody says, "Well, I'm concerned about long-term side effects from the vaccine," I would say, well, what are those side effects? Because we haven't seen them. I have a friend who is 39. To me, I would call that young. She lost about 6 months of work because of her COVID. I know one of the early patients in Chicago that required a double lung transplant was in her 20s. You know, having to be on transplant medications for the rest of your life and having to live with someone else's lungs in your body is not an insignificant kind of situation. And so you know, people can always argue that I'm young and healthy and nothing bad is likely to happen to me. But even in folks that are in their 20s, we're seeing excess deaths in the last year over what we would expect. So COVID is killing people even in their 20s. You know, the pediatric deaths have been few and far between, thank goodness. But I don't know why you want to assume that risk for death or that kind of disability, like having to have a lung transplant when you're in your 20s. And we're learning more all the time about things like long COVID, where people have chronic fatigue or other kinds of ongoing symptoms. And so nobody has a certified stamp in their passport that says, if I get COVID, I'm not going to have any of these complications. Some of the people with long COVID were not sick enough to be in the hospital. You know, it's a roll of the dice even for young people to get this disease.
Yeah. Thank you. That was, I have to say, I had chills when you talked about the 20-year-old having a lung transplant. But that is the reality. And so we want people to hear that. So thank you for sharing it. Cherry, do you have a question?
I do. As I go into buildings as the director of clinical services, I have lots of questions, but one of the biggest questions that I have is, if I get the COVID vaccine, can I still transmit the virus to someone else, to my loved ones?
Yeah, so at this point, it is limited data. They actually sort of looked at this with the Moderna clinical trial. Now, the clinical trials were really set up to figure out whether it prevented people from getting sick, rather than testing whether it prevented people from having asymptomatic infection. But they did do some PCR testing of folks who were asymptomatic. And I think in the placebo group that they tested, they had like 39 cases that they detected. And in the vaccine group, they had 15. Now, these are pretty small numbers. So I can't tell you that that's really the kind of ratio that you're going to see at the end of the day, but it does suggest that getting vaccinated is likely to protect your friends and family from getting the virus from you, even if you got an asymptomatic case. But it's not likely to be 100%. That was done with 1 dose of the vaccine. It could be considerably better with 2 doses, but we don't really know what that number is for sure. Secondly, one of the things I haven't really focused on about this virus that's a little different than other viruses is that this virus does seem to be better able to do kind of the super spreader event than other viruses. You may have read the article about this choir practice in the Northwest, where one person infected a huge number of people at their choir practice. I suspect that people who are vaccinated are not only going to be less likely to get sick and less likely to transmit the virus, they're going to be less likely to be those kind of super spreaders, because I don't think they're going to have as high a viral load. I think their immune system is going to kick in faster and limit the amount of virus that they have in their nose and throat to sing to their neighbor at church, or to spread to somebody talking across a break room table. So while we don't have precise numbers about that, I think it's going to be clearly advantageous to you for all of those situations to be vaccinated versus not being vaccinated.
Great, thank you. Next, we have Hamilton Grove. And you're going to need to unmute.
Sorry.
No, that's okay.
Actually, you already answered the question, because our question was, will the vaccines protect us from the new variants of the COVID? And you did answer that earlier. It seems to be protecting it at this point. Yeah.
That's correct.
Okay. All right. Okay, and now we're back to Goshen.
All right, between Pfizer and Moderna, which vaccine do you think is the better option? What do you think about Johnson & Johnson's vaccine that they have coming out?
At this point in time, the best option is the one you can get in your arm the soonest. So I got the Pfizer vaccine because that's what we had available. I certainly would have been very comfortable with the Moderna vaccine. These are very similar vaccines, reasonably similar doses. You know, the second dose is a week apart. They're not identical. But I think either Pfizer or Moderna, whichever one you can get is the one to take. As far as the other vaccines go, there are a number of other promising vaccines. I hate to try to overly sell any of those vaccines because the data has not yet been made public in terms of it being submitted to the FDA for review. So they do have to put out public data when they submit it to the FDA. Right now, all the information we have is basically based on press release, and isn't it isn't as clear. But the reality is, I think most of these vaccines at this point, based on the early information we have, are probably going to be around 90% or better for preventing hospitalization and death, which are the key things that people want to avoid. And, you know, if we have a one-shot vaccine and you hate needles, then maybe that will be a compelling case to get the one-shot vaccine instead of these two-dose vaccines. And, you know, if we get other guidance from the Centers for Disease Control, the FDA, saying, you know, this particular vaccine seems to work better in younger people, then maybe there'll be recommendations about using it in younger people. But the two we have approved now seem to work well, and work well even in older folks and folks that are sicker. And so I'm very comfortable recommending both of them.
Okay, thank you. And now we're going back to Ohio, Walnut Hills.
Yes, this is a question that at least I get asked daily, if not from our team members or the residents. But when do you think we'll be able to get back together with our families again now that the vaccine is available?
So I kind of hesitate to do this, but you asked me the question, so I'll give you my best answer. And it's being recorded. So, you know, a year from now, we'll all be able to come back and look at this and laugh, because I don't really know how the whole pandemic is going to play out. And, you know, part of it is that in terms of what's going to happen with this pandemic, to me, it's more complicated than, say, something simple like predicting what the stock market's going to do. And obviously, if anybody could really predict what the stock market's going to do, they would be even richer than Warren Buffett. I mean, you can make a lot of money if you know what the stock market's going to do. And the reason we don't really know what the stock market's going to do, or the reason we don't know what the pandemic is going to do, is because these kind of things depend on millions of people making hundreds or thousands of decisions. And so I can't really predict which of you is going to go out to a bar tonight and get COVID, or which of you is going to say, this is a good night to stay home and not get COVID. Which of you is going to visit your elderly grandmother, and which of you is going to say, you know, it's just not wise for me to do that today because somebody coughed on me in the hallway. So I don't really know what's going to happen with the pandemic. But at this point, my prediction falls into kind of three categories: the good, the bad, and the ugly. And I would say that at this point, to me, there's about a 60% chance that things are going to look good, that we're going to see continued fall in the rates of COVID. People are going to accept the vaccine. They're going to get vaccinated and develop immunity. The weather is going to help us out. There, I think, is a growing public consensus or normalization about masking. There's not as, there still are people who are anti-maskers who come to the Elkhart County Board of Commissioners and complain. But in general, when I go out in public with my mask on, I see more other people with their masks on. And for Elkhart County in particular, we saw our rates significantly fall when the governor and when the local government put forth mask mandates and people started wearing masks more. So I do think the masking is important, both from what we see in the scientific literature, but also just my own experience with what our rates have done as people have been masking more. And so I think we could mask up, socially distance, wash our hands, take our shots, and by the summertime, we could be in a much better place. We could be feeling pretty good. And I would say there's about a 60% chance that that's what's going to happen. I would also say there's probably about a 20% chance of this not going as well. I just saw some numbers today that it looked like a lot of the vaccine supply, or enough vaccine to get the United States to a level of herd immunity, and I haven't explained herd immunity, but some of you are probably familiar with that concept, that we'll have enough vaccine by September to do that. So September seems like a long time away for me. And there is a law that some of you may have experience with called Murphy's Law. And Murphy's Law will say that something's going to go wrong. One of the vaccine manufacturers will have trouble producing their vaccine. One of the vaccines we expect to get approved won't get approved. The vaccine hesitant and anti-vax folks in the country are going to rise up and make sure that we can't get 70 or 80% of the population vaccinated. And in that bad scenario, I see this dragging out another year and a quarter, and we could still be struggling with this through next winter if we don't have vaccine, if people don't take the vaccine, if things just go badly, because things often go badly. I think that's less likely, but I think there's a chance that that'll happen. And then the last 20% in my prediction is really the ugly. And the ugly would be if we really see the variants rise in a significant way, and if we don't help the rest of the world get vaccinated such that this virus continues to spread unabated across the globe. And, these variants, the virus is always mutating, and most of the time it doesn't mean much or do much. But when you start thinking about it mutating in 10 people, that's pretty different than mutating in 10 million people. And even 1 million people is pretty different than 1 billion people or 5 billion people. And we could see an ugly variant that comes up that is more infectious, hopefully not more lethal, but more problematic, something that we actually do have to redesign vaccines to counteract and so forth. And in that case, this could be a longer, uglier slog. And while I would hope that we will see unwinding of a lot of the public health measures that we've had to do to control this so far, if we have variants and people are still dying at high rates, I mean, are you going to want to go out to a bar or to a restaurant, to a crowded concert? Some of us will, but some of us are happy enough at home or happy enough with the people in our bubble that we will continue to stay in our bubble while the situation around the globe is terrible. And if that ugly situation happens, then it's going to be a long, tough slog, particularly for, the travel industry and restaurants and all the people that have been hit hardest already. So getting vaccinated now before the virus can infect all of us and create all these mutants is really our best chance to keep the mutants in check. And I think that just thinking we're going to let this rip through the whole world's population and that nothing bad could happen is an extremely optimistic view of what's likely to happen. You don't want to have, you know, I don't know how many people are on the planet these days, 8 billion. You don't want to give this virus 8 billion chances to mutate into something worse than it already is.
Okay. Thank you. Amy, I'm going to let you wrap it up for us.
Well, I consider myself to be pretty somewhat knowledgeable, not as knowledgeable as you are, Dr. Nafziger. I do have a Facebook PhD a little bit, so I read a lot of stuff on Facebook, and I've learned quite a bit today. So thank you very much for your input and your insight. I've also seen you several times on some of the Goshen Chamber seminars that you've done, and you've just an excellent resource for us. So thank you for coming on with us today and talking with us about the vaccine.
You're most welcome. And if I was going to give my little concluding spiel, I would just say, think about talking to your friends and family about getting vaccinated. People might look at me and not trust me because I'm white or because I'm male or because I'm an old man or because I slip into medical jargon when I talk or whatever. But each of you is going to be an important person in your social network at convincing other people to get vaccinated. And you're going to be way more trustworthy with your family and friends than I am, or that, Tony Fauci is, or any of our presidents. So you have a voice and you have a chance to share the information you have and that you understand with your friends and family to help them work through their concerns. And hopefully they'll make good choices and we'll get back to normal as soon as we can. Thanks.
Thank you.
Thank you.
Thank you.
Thank you, everyone. Have a great day.
Hey, you too.
Bye.
Okay.